Hey there, it's Dr. Justin Marchegiani with Dr. Roger Murphee here. We're going to be chatting about fibromyalgia and the Fibro Summit coming your way. Dr. Roger, welcome to the podcast. How we doing?
Hey, Dr. Justin, so glad to be here. Thanks for having me. This is going to be fun.
Yeah, I'm really excited to be part of your summit as well. That summit will be coming out, I think, on September 28th. So we'll put some links down below so you guys can get subscribed to the summit. So let's talk about fibromyalgia. It's kind of one of these, subjective diagnoses, right? A doctor kind of comes in and they do these, like they look for different tender spots. How does that diagnosis work?
Well, the frustrating thing about fibromyalgia is there's still doctors who don't believe it exists. There's still some out there who have that mindset, and those that do don't really understand it. They don't really know how to treat it other than tell their patients to learn to live with it. And the diagnosis is
Hmm.
typically one of elimination. So there's no really definitive blood test out there that will show you have
Right.
fibromyalgia. And it typically takes 3 or 4 years and half a dozen to a dozen doctors before you finally get the diagnosis. And you're right, it typically is it's a hands-on type of examination, but after they've done all the other workup to rule out rheumatoid arthritis or any type of autoimmune disease or MS, and then eventually you get the diagnosis of fibromyalgia, and you're kind of stuck with that because that's kind of a good thing and a bad thing. I mean, it's good to finally get a diagnosis, but once you do get that diagnosis, it follows you forever. And a lot of times that doesn't serve you very well.
Yeah, totally. So if you go online and you look, you can get an image of all the different kind of tender pain spots that they'll kind of rub gently, and they're kind of looking for this central allodynia, this pain that's it's not proportional to the amount of physical stimulus you're putting in when you're touching these different spots, whether it's the shoulder, collarbone, neck, arm, just kind of the different joints. So the doctor's coming in, they're going to be running maybe ANA, HLA-B27, all of these kind of autoimmune markers. If none of them come back, then they're going to that physical examination. And if there's pain in those spots at all, right, then that's kind of the diagnosis. But I mean, it's not really helpful outside of the fact that you got it, but we got this kind of path in the road. We have functional medicine, or we have a lot of these biologics and pain meds. So what happens next?
Well, the thing is, once you get the diagnosis, oftentimes I think people have a sigh of relief because they think, oh, well, at least, I'm not crazy, because a lot of times they're made to feel they're either lazy, crazy, or just a hypochondriac. And nothing can be further from the truth. I mean, nobody would want to make this kind of stuff up, that you can't sleep. You have this diffuse, sometimes disabling pain, no energy, just exhausted, irritable bowel, restless leg syndrome, low moods, anxiety. Nobody wants to make that kind of stuff up. But what
Totally.
the diagnosis, then unfortunately, what happens is you get passed from more, another doctor. You get on this medical merry-go-round, and every doctor you come in contact with, if you mention any symptom, any condition, they're going to try to sweep your fibromyalgia symptoms underneath the fibromyalgia rug and tell you, oh yeah, the stomach pain that you have, that's fibromyalgia. Oh yeah, the thrush that you have on your tongue
Oh
is
my gosh.
whatever it is, the migraines. And all these are warning signs, they're symptoms, and symptoms are just telling us that there's something underlying this symptom that is, we need to be looking for the causes and not treating the symptoms. But unfortunately, once you get that diagnosis, really most doctors just are happy just to tell you to learn to live with it. They're not going to keep looking for the underlying causes.
Yeah, I tell my patients this all the time. Like most of the time, conventional medicine, they're looking at the downstream symptoms, and typically a diagnosis is a bunch of symptoms that are in an organized fashion, right? With a lot of the central allodynia pain, right? That's your fibromyalgia. If it's autoimmune type of pain where there's autoimmune markers, maybe that's rheumatoid arthritis. So you're just looking for these different symptoms and this different pattern. And once you have those symptoms, they give you an ICD-10 code, and then from there they can prescribe you a drug. Now, fibromyalgia tends to come together a lot of times with chronic fatigue. So you get people that are sore and also tired.
Yeah.
Now, we know in functional medicine that there may be other kind of root causes upstream, like with the gut or with the hormones or the adrenals or the thyroid. What are like just the top three like root cause patterns that are upstream that you see are driving a lot of the fibro symptoms downstream?
Well, the main thing, Justin, is that
Yeah,
this allodynia, which is this low pain threshold.
right,
For them, their pain is magnified. I mean, you and I can go,
right.
we can go get a massage, we can shake hands, we can, hug our partners, we can do things that, wouldn't bother us at all. But the fibromyalgia patient, any of that stimulation could send them over the top. So pain is magnified. And it does
Yes.
where that pain's coming from. It can be from wear and tear, osteoarthritis, or osteoporosis, bone loss. It can be from scar tissue, past surgeries. It can be from nerve damage. It can be from elevated blood sugar issues. But they have central sensitivity pain syndrome, which means their nervous system is over ramped up and pain is magnified. And the place to start with these individuals is you've got to raise the pain threshold. And the best place to do that is making sure that they have plenty of serotonin. So this
Mm,
brain hormone, that you're familiar with, the
yeah.
higher your serotonin level, the higher your pain threshold. And the higher your serotonin level, the less anxious you are, less depressed you are, more mental clarity you have, and less likely you have are to have IBS because you have more serotonin receptors in your intestinal tract than you do in your brain. So the place to start for these individuals is number one, making sure that they have plenty of serotonin because anybody that has true fibromyalgia, they're going to be deficient in serotonin. And that's one of the main driving factors of the underlying symptoms that they have.
That's interesting because serotonin we know comes from the amino acid tryptophan, right?
Yeah.
So I find common thread is going to be poor digestion in a lot of these fibro patients. So poor digestion, maybe low stomach acid, low enzyme. Maybe their diet's poor. Maybe they're not eating enough protein. Maybe they kind of were on a vegan vegetarian kick. Maybe there's a gut infection that's impeding digestion as well. How much do you see digestion being an impediment as well as maybe digestive infections too?
Well, it's certainly a big part of it for sure. And in the fibromyalgia community, what we see is that genetically, some of them are disadvantaged, just the way God made them. They
Yeah.
convert tryptophan into 5-hydroxytryptophan. They have a block in their kinase enzyme pathway,
Yeah.
and because that conversion's not made, they're at a disadvantage. So they're low in serotonin. Certainly, you
Is
are.
B6 playing a big role in that too?
Absolutely, yeah. So the cofactors, as you bring
Yeah.
up, to make serotonin, you need tryptophan, which turns into 5-hydroxytryptophan, the B vitamins in particular,
Yeah, it's
B6,
big.
uh, B2, B3, and
Hmm.
then you need vitamin C and magnesium. That's what makes
Yes.
it. No one has an antidepressant deficiency, you know,
Yeah.
but you could have a 5-HTP deficiency or a B vitamin deficiency, and
Yes.
you probably have a magnesium deficiency if you have fibromyalgia. But the place to start for these individuals is making sure we get that serotonin level up. And when we do that, we see their pain threshold goes up. Absolutely.
Yeah, I see that a lot. I run a lot of organic acid tests and I'll look at 5-hydroxyindole acetate. And usually that's very high or very low. So there's usually a burning or a total depletion issue there. And I've never seen a fibro patient with really good digestion. There's always some bloating, some gas, some SIBO or a gut infection. I almost always see that. Now, what's your take on beta endorphin? Because beta endorphin is kind of our natural opiate and it's made from 19 amino acids. So, I mean, obviously we see this amino acid kind of trend there. Any feedback on beta endorphin?
Yeah, one of the things that I have my patients do, they fill out in the new patient questionnaire. They'll have a brain function questionnaire, little survey, and it across the board it shows that they're low in serotonin. But then they may be deficient in dopamine and opioids and some of these other things that show that they have other amino acid deficiencies besides 5-HTP. But
Bingo.
uh,
Yep.
so it definitely shows up. It's a pattern that we see that they
Yes.
deficient in these amino acids for, whether it's genetics or, poor diet, or there's something that's compromising their ability to be able to absorb these nutrients like SIBO or leaky gut or, some type of bacterial overgrowth.
Yeah. So my strategy, I'm curious to get yours. So my strategy is I try to figure out a way to get the sympathetic nervous system in check. Because most of the time, the adrenals is that kind of gateway between, the sympathetic nervous system. It's kind of how that, when you interpret stress, you're making adrenaline, you're making cortisol. And when you have that level of stress, you're going to be burning up a lot of those neurotransmitters. So I try to get the adrenals under control. And then I work on supporting more of those amino acids, more of those cofactors. And I try to get tests so I can get specific what is the root issue. And I'm just curious to know your take on that. What's your kind of out of the gates approach?
Well, for me, from doing this for 20 years,
Yeah.
I find there's 4 key things that have
Hmm.
to really be addressed, because if you got 15 tacks in your foot and you
Yeah.
pull out 2 or 3 tacks, you're not going to notice a difference. And that's
It's a
what
great
most,
analogy. Excellent analogy.
what they're doing is they're taking resveratrol, or, they're taking CoQ10 or turmeric, and those
Yep.
are great things. I mean,
Yep.
those are great. But if you don't pull out a bunch of tacks real quick, you're never going to see a difference. So
Totally.
use the analogy that we're all born with a stress coping savings account. And in that stress coping savings account, we have certain chemicals that allows us to be able to deal with stress. So we have serotonin, dopamine, norepinephrine, cortisol, DHEA, pantothenic acid, cortisol, these things that are there. And anytime we get under stress, we're using these chemicals to deal with stress. But those with fibromyalgia, they have bankrupted their stress coping savings account. So
Yep.
they have this deficit. And then when they, get up to face the day, they're already done. They just don't have those chemicals they need. So the first thing that's got to happen is we've got to replenish that stress coping savings account. And that is done by deep restorative delta wave sleep. So if they're not getting a good night's sleep on a consistent basis, they're going to have many of the symptoms that we associate with fibromyalgia. If you're not getting deep restorative sleep, your inflammatory chemicals are increased by 40%. They're going to have more pain. If they're not getting deep restorative sleep, their pain threshold goes down, so pain's magnified. They're obviously going to be tired, going to have fatigue, brain fog, which is a common symptom of these individuals. Irritable bowel, you have more, as I mentioned, more serotonin receptors in your intestinal tract than you do in your brain. Restless leg syndrome starts to show up. Once they can get a consistent, deep restorative sleep, then they're going to see that many of those tacks, we can start to pull those out. So the first place to start is deep restorative sleep, making sure they're getting plenty of serotonin. And then the next place is, as you already mentioned, is the adrenal fatigue.
Yeah.
Because if they get a good night's sleep and they start to feel better, then even though they're cautioned not to do this, in my book, they'll go out and do things they haven't been able to do in years. And then they'll have a fibro flare and they'll be back in bed because they don't have the stamina or resiliency to stress, physical stress, mental stress, real or imagined. And so if they don't fix their stress coping glands, the adrenal glands
Yes.
will be vulnerable. The third thing is, and you already mentioned this astutely, is you've got to fix any kind of GI issues,
Yeah.
problems with digestion or problems with elimination, problems absorbing. And every fibromyalgia patient I've ever worked with last 20 years, there's something there, whether that's SIBO, leaky gut, yeast overgrowth, parasites, or just reflux and malabsorption. They're not absorbing their
Huge.
nutrients. That's got to be fixed. The last thing, which really could easily be the first thing, is you've got to lay the foundation with high doses, but the right combination of vitamins, minerals, amino acid, and essential fatty acids. Because if you
Mm.
don't have these building blocks, you can't make these hormones and chemicals that they need to right themselves. And most people have tried a multivitamin, they've tried this, they tried that, but what they've taken is so inferior to what they need. They're looking at things like a Centrum Silver or one a day,
Oh yeah.
which is
Oh yeah.
based on the RDA, the recommended disease allowance, right?
Yeah.
It's just enough to get, keep you from getting scurvy or beriberi. It's not going to, provide optimal nutrients that you need to be healthy. It's, so it's this 4 pillars that I think are just crucial. You got to get
Yeah.
those. And then, really once you do that, you've pulled out a lot of tacks. You maybe pulled out 10 or 12 tacks. Now there's 3 tacks that are still left and they're still giving you trouble. but at least you've made this dramatic impact. And then you got to go look for what are some of the underlying other underlying conditions that may be driving the symptoms, like, problem with their thyroid.
Yeah, and it's really interesting because not all the tacks create the same amount of pain. So sometimes it's the eighth tack when you pull that out, it's like, whoa, a really big improvement. And sometimes you pull them out and then the improvement's delayed. Like it's like, oh, I'm starting to see a 5 or 10% improvement 1 to 2 months later. So it's interesting where the compliance factor, like really getting the patient's mindset on board, is crucial, because it's never going to be every now and then that you get a miracle tack. Sometimes it's delayed. So you got to paint that big picture, and compliance is big. And when you talked about some of the nutrients, do you have a really good multivitamin that you formulated, or what should people be looking in their multi? Is it certain doses? Is it certain the quality of the nutrients? What should they be looking for, Dr. Roger?
Yeah, so years ago when I started treating fibromyalgia, I had a medical clinic where I had 5 medical doctors worked for me, and we did high doses of IV therapy. So we did Myers cocktails back then.
Okay.
And we found by doing that, Justin, that if we gave them these vitamins and minerals, that they slept better, they had less pain, they had more energy, they had better mental clarity, they just felt better. But it wasn't practical for people to come
Every day. Couldn't do it.
hooked up to an IV.
Yeah.
So years ago, I developed this thing called the CFS Fibro pack, which has high doses of vitamins, minerals, amino acids, and essential fatty acids in there, and some other things like malic acid, magnesium,
Yep.
potassium aspartate to help
Yep.
drive the cellular energy.
Mhm.
But you can find something similar if you. But that is the cornerstone of what my patients take. They take that as well as some other supplements like a good digestive enzyme, an over-the-counter adrenal cortex supplement, and then the 5-HTP. That makes up this thing called the Jumpstart protocols, that people who read my book, they're encouraged to try that on their own and get as far as they can before they reach out to me to set up a phone consult.
Interesting. And you mentioned the serotonin, which you mentioned lowers that pain threshold, which is really important. But we know serotonin also is that precursor to melatonin, which helps with sleep. And you mentioned the delta wave and the sleep. So it's kind of like everything's kind of connected. It's not just like one web. It's like you hit one web and it moves the whole spider web. So you increase the pain threshold, but then you help the sleep, and then the sleep helps the adrenals, and the adrenals help the inflammation, and it just keeps on spiraling.
Yeah, it's all connected. It's a myriad
Yeah.
of connections there. Yeah, the 5-HTP increases your natural sleep hormone melatonin by 200%. So that was when I started doing the research on that. Well, it's been 2 decades ago, and found that correlation. It was a no-brainer to start putting my patients on that. And then thankfully, along with making the serotonin, it really encourages them to be able to wind down and be able to get a good night's sleep. Now, there's some other things typically we have to add to that. Sometimes adding some additional melatonin to the 5-HTP, but the 5-HTP has been extremely helpful for these folks.
And if you're not getting, if you're not getting the optimal results regarding sleep, I imagine you may keep the 5-HTP there to help with the serotonin so the pain improves. But when do you add in melatonin to the mix? When does
So
that happen?
wait for my sleep protocol. It's they start off with 100 milligrams of 5-HTP 30 minutes before bed with a
Hmm.
little bit of grape juice. Doesn't take much, but the
Hmm.
grape juice is going to cause the body to release insulin to help pull that serotonin past the blood-brain barrier,
Yeah.
going to the stomach. Just a little trick. And then if they don't fall asleep within 30 minutes, then and sleep through the night, the next night they go to 200 milligrams. And then if they need to, they go to 300 milligrams. But if they get up to 300 milligrams and they're still not falling asleep, or they're not staying asleep, that's when I would start to add the melatonin, preferably sublingual melatonin, somewhere
Yeah.
around, 3 milligrams or so. And they can increase that up each night up to about 12 milligrams. And then hopefully that does the trick. If it doesn't, um, then I would add things like gamma aminobutyric acid, GABA.
GABA. Yeah.
So I have a little sleep formula that I put together that it's a combination of GABA and L-theanine, ashwagandha, and valerium,
Mm.
and passion flower, that can be taken to it really calms them down before bed. But it's even more useful for those individuals who wake up at 2 or 3 o'clock in the morning, can't go back to sleep. They can take this product called Delta Sleep or something similar, and it'll allow them to fall back to sleep within 10 minutes or so. And it doesn't make them feel hungover, dopey, or sleepy the next day like some of the prescription medications would.
That's great. I think we're just really dropping a lot of key clinical pearls here. So if you're a patient and you're have these kind of issues, try to glom onto one or two of these things. I think it's really important, especially if you're in that fibromyalgia camp. You really want to work with the practitioner because there's a lot of, as Dr. Roger gave the example of tacks you got to pull out. And these are a couple of one or two key tacks, but there's always a plan B, a plan C, a plan D. It always seems easy when everything works with plan A the first time around, but I think Dr. Roger will probably agree. A lot of times you have to dig deep into that tool basket with a lot of other plans too. Would you agree?
Oh, absolutely. But I think you got to lay the foundation
Yeah.
first. And I think
Yep.
what trips people up with fibromyalgia and those trying to treat fibromyalgia is they try to put the cart in front of the horse. You know, fibromyalgia,
Yeah.
as you know, there's such a unique individual. And a lot of times they may go to an integrative doctor or maybe a functional doctor, and he or she will, okay, well, let's put you on bioidentical hormone replacement therapy because that's, as a female, that's a lot of times what they do. But that may not work, and usually doesn't. To me, these 4 steps that I just mentioned, that lays the foundation, and
And do
then
you mind if we repeat the steps one more time, what they are?
deep restorative sleep. You got to replenish your stress coping savings account, and the way you do that, you make deposits into your stress coping savings account by going into deep restorative sleep.
Sleep. Got it.
Your serotonin level up, so 5-HTP. And then the second one is you got to fix adrenal fatigue.
Mhm.
Everybody has fibro has adrenal fatigue, so I use adrenal cortex glandulars for my patients. And then number 3 was digestive issues. I put everybody on a digestive enzyme, and then if they need other treatments for SIBO or leaky gut or other things, we'll deal with that. And then the last one was a good high dose multivitamin mineral formula with essential fatty acids, fish oil, malic acid, extra magnesium, which is so important. But those 4 things provide the foundation really to build upon. It really, what it does, it's if you kind of think of if you got this
Yeah.
real complicated jigsaw puzzle and you just throw all the pieces out on the table, and until you get the corner of the puzzle right, you're you could just be looking forever to put the pieces together. But once you get the corner, now everything starts to come together. You can build that puzzle. So
Mm.
the first 4 things make up one quarter, a corner, I'm sorry. And then the puzzle starts to come together, but you may have to, find another piece of the puzzle that's eluding you. Could be a problem with your thyroid, could be a problem with yeast overgrowth, could be a problem with food allergies. But if you don't get that first corner, boy, you're going to struggle. You're really going to struggle.
Totally agree. That makes a lot of sense. Now, when you're working with patients, are you testing their adrenals? And it sounds like you're finding a lot of low cortisol in your patients. Is that true?
Yeah. So I think, with these individuals, they're very complicated. And ideally, although I do have programs where they can try to do it themselves, to talk about that in the book. Ideally, you want to test. I mean, you and I are trained in functional
Yeah.
medicine. You don't want to guess. You really want to try to laser in, find out what are the key linchpins for helping these folks, and you want to know what's going on. So yeah, when I'm doing a 4 sample saliva test for their adrenals,
Hmm.
I see it's all over the place. So it's low in the morning, it's bottomed out, and sometimes
Yep.
it's sky high first thing, because they're not sleeping.
Yep.
That'll drive that level up. But it's about really balancing that out because, as you know very well, a lot of times we'll see that their DHEA is their cortisol level is okay, but their DHEA is really high, and that's a sign that the body's trying to hang on. Eventually,
Yep.
levels are going to bottom out, right? Or their
Correct.
DHEA is bottomed out and their cortisol levels are bottomed out, so you got to treat both of those. Or you may find, like I do with a lot of patients, is that they have a low cortisol in the morning, and then as the day goes on, it should keep going lower. But for these individuals, their cortisol level actually spikes towards bedtime, so it's like they're catching their second wind,
Yep. It's a
and they
reverse rhythm almost.
all day they're exhausted,
Hmm.
and then about 9 o'clock they catch the second wind, and they're like, "Oh, well, I haven't been able to do anything all day. Let me go clean up the kitchen or straighten up or whatever it is." And then they miss the window of opportunity to get in bed on time, and now they're, they really just continue to throw their sleep wake cycle into further helter skelter.
That makes sense. Do you test any of the total cortisol? Like, do you do any of the urinary cortisol as well to get a window into free as well as total?
I don't do that, and I find that I guess probably just from doing this for so long, I know that and I would say, when I say the majority, I mean 98% of them are going to have a problem with their adrenals, and if
Hmm.
I can
Oh yeah.
just make sure what the pattern is, then I
Hmm.
can get them on the right supplements that will, that will correct that.
Yeah, that makes a lot of sense. What also do you see in regards to an infection pattern? Like with patients, I'm seeing H. pylori, blastocystis hominis. Sometimes you see things like Epstein-Barr, maybe even a Lyme issue. What kind of infections do you see? And it sounds like you kind of have that priority. You hit those four pillars that you mentioned, right? Adrenals and the nutrients and the sleep and et cetera. And then you kind of, do you dive into infections later? Is that part of when you're addressing the gut stuff? Where do the infections come in? And what are the top maybe 3 or 5 infections that you see that play a role with fibromyalgia?
Probably the most consistent one is yeast overgrowth. So I test everybody for yeast overgrowth. I test everybody for parasites. Blastocystis hominis definitely shows up.
Hmm.
SIBO is definitely a thing that
Yeah.
is, for whatever reason, I think you kind of run into these patterns where you get one, then you get two, then you get, dozens of them at a time. Mold issues certainly are starting to show up, but definitely infections are there. I'm really careful not to go after them initially,
Hmm.
certainly not aggressively, because with fibromyalgia, they can't handle the stress. They bankrupted their stress coping chemicals, and they bankrupted their stress coping gland. So stress is magnified. I don't want to get aggressive on treating yeast or SIBO or some of these things that show up until I get them going into deep restorative sleep, start working on their adrenals. And then, yeah, absolutely. Then you have to look at, definitely H. pylori shows up as well. You have to start dealing with those, because that's something that's going to be left over, that's going to create if it's, if it's leaky gut, as you know, that's going to create more inflammation and more pain. So
Yes.
with at some point.
I just really wanted to highlight that for the listeners because this is probably the biggest mistake I see with a lot of my patients and people that I connect with online is we just live in this generation that's antibiotic driven. Oh, you have an infection, staph, strep, STD. Here's an antibiotic, knock it out. And that can be stressful on the body. Number one, it wipes out the microbiome, which affects the immune system, gut permeability. But it's stressful going after an infection. And when you don't have the reserves, your sleep's already a mess, you're nutritionally deficient, you can't digest. That's like a big stress ball in that bucket or another 5 tacks underneath that foot. So I'm really glad that you highlighted that.
Yeah, and I think that's the thing, is what you want to do with fibromyalgia. You want to try to find and fix the underlying causes, because really, fibromyalgia is just a name. That's all it is. It's a name given to a group of symptoms that people have in common, and we call it fibromyalgia. And so if you can start to find and fix each underlying cause, eventually you're going to get your life back. And that may take different things, but um, certainly the gut is, that's number four. You have to fix that.
Totally. Now, you mentioned a couple of different things, and I know the protocols are going to be specific to each individual person and where they're at. I get that. So, people that are listening, I want you to just talk about, do you have like a couple of your favorite herbs on the gut side? And also, do you have a couple of your favorite herbs on the virus side? And how much do viruses play a role in this whole thing?
As far as, I don't use a lot of herbals. I do use some, but I don't use
Hmm.
as many as some may think. I really
Hmm.
think that in the fibromyalgia community, a lot of them have chemical sensitivities, have issues. So you
Hmm.
gotta be careful what you do. And now, having said that, I also really recommend everybody get a food allergy test, because food allergies
Hmm.
are great masqueraders. But for digestion, the first thing I do is put them on digestive enzymes or on betaine. Make sure that we
Hmm.
start from the beginning. Make sure they're digesting their food.
That's key. Yeah.
If they have issues with yeast overgrowth, or even SIBO, then I'll turn to things like biocidin, which has oregano and
Okay. Yeah.
berberine and some of these golden seal herbals in there.
Black walnut, echinacea. Yep.
Yep. But I don't use a tremendous amount of herbals, just for the fact that I really find that using the right doses of the vitamins and minerals and essential fatty acids and amino acids typically start to turn these individuals around, but definitely there is a place for berberine and
Mm-hmm.
isosalinic acid and caprylic
Mm-hmm.
acid. I mean, there's definitely those can be incredibly helpful for these folks.
How about the virus stuff? Do you use any natural antiviral supports? And what viruses do you see? And what are your like top three on the antiviral side?
It's interesting that I don't see a lot of viruses, which really
Hmm.
surprises people when I say that. I used to more so than I do now. Let me explain why that is. People think of fibromyalgia as being driven by a virus, and they can have viruses. But if you look at, fibromyalgia is on one end of this clothesline, and chronic fatigue syndrome is on the other end of the
Hmm.
clothesline. And sometimes they get lumped together, and you can have both. But if you look at true fibromyalgia and true chronic fatigue syndrome, with true fibromyalgia, their symptoms are, number one, pain, right? But they can't sleep and they have no energy. And then if you look at the true chronic fatigue syndrome, they can have trouble with their sleep and they do have achy flu-like pain. And obviously the number one symptom is no energy, so fatigue. But the difference between the two is that those with fibromyalgia don't necessarily have anything wrong with their immune system. Those with chronic fatigue syndrome all have some type of immune
Mm.
dynamic, something that is compromised that, so that they're always fighting off some type of infection. And absolutely, in those individuals, you got to go after it and find out what that is, and use things like lactoferrin or
And
use
yeah.
um, thymus extract. Some of these things that
Mm-hmm.
help the
Glandulars.
system, that can be incredibly beta 1,3 glucan. Some of these things that I use for these individuals. But it's odd because over the years, for whatever reason, um, I have attracted less chronic fatigue syndrome patients in the last probably 10 years than I have fibro. To me, fibro, and I hate, and be careful how I say this,
Yeah.
fibromyalgia is, I won't say it's easy, but for me, there's a system that seems to work. Chronic fatigue syndrome, once you start working with that, if you're not careful, you open up Pandora's box and you find that not only is it viruses, but then you also have parasites and you have um, Lyme and many things that you mentioned. That tends to be more down on this end of the clothesline with chronic fatigue
Okay.
syndrome than it does fibro.
And you're differentiating that between the fact your fibro have the central allodynia, that's just the wound up nervous system, the pain spots at the joints and throughout the body, but they don't really have the energy problems. Their energy's still pretty good. Is that the differentiating factor?
No, the difference, because with fibro, I mean, they have many of the same symptoms as those with chronic fatigue syndrome.
Yeah.
What separates, and you can be anywhere along the clothesline, but what separates the two is that those with chronic fatigue syndrome always have a compromised immune system. Always.
And you're saying compromised immune system. So the fibro patients still might have fatigue, but
Mhm.
you're just not seeing what a diagnosed autoimmune condition along with fibro, or they get sick a lot. How are you defining compromised immune system?
So for those with fibromyalgia, they normally don't have problems with random sore throats. They don't have swollen lymph glands. If we test them, they don't show antibodies to Epstein-Barr virus or cytomegalovirus. Chronic fatigue syndrome, you're going to see elevated Epstein-Barr virus, cytomegalovirus, herpes viruses. They're going to get random sore throats out of the blue. They're going to have palpable lymph nodes. They're going to be swollen glands. Oftentimes they have issues with laryngitis. They just lose their voice for days at a time because they get so exhausted. With fibro, you can have some of that, but that's not the norm. In chronic fatigue syndrome, that's the norm.
So I'm just trying to wrap my head around this because the diagnoses are kind of a little bit flaky. So if these fibro patients they're still really tired, right? What's the conventional different? Like if you're a conventional medical doctor, what makes you diagnose this person with chronic fatigue with the immune stuff, but these people over here without the immune stuff, they're still tired. What allows them to get that chronic fatigue diagnosis on the conventional side?
I think typically it comes down to the doctor that they see. So if it's a
Yeah.
that's more familiar with chronic fatigue syndrome, they're probably going to get that diagnosis than they would fibro. If it's a doctor that's more familiar with fibromyalgia, they're going to get that diagnosis. And right now, you've got, even though there's not a lot, you've probably got more doctors who are familiar, at least with fibromyalgia. They don't really know how to treat it. than they are with chronic fatigue syndrome. That illness, chronic fatigue syndrome, is something that most doctors really don't know anything about.
And there's another name for fibromyalgia over in Europe, right? It's the myalgia. What's the name for it in Europe?
Yeah, well, now for chronic fatigue syndrome, it's myalgic encephalitis. So it's
Encephalitis. Yeah.
yeah, ME. Yeah.
Yeah. I mean, yep.
Yeah.
Okay. And so it sounds like to me, it's not necessarily the diagnosis that matters. It's more the immune symptoms of antibodies to these different viruses, and then that chronic immune reaction, lymph nodes, chronically sick. Is that kind of, if we kind of really boil it down, is that more specific, you think?
Yeah, but I think we got to be careful, because I
Yeah.
think there's a misconception that fibromyalgia is an autoimmune disease, and we've
Hmm.
never seen that in any. In we've been looking for the smoking gun, and it's not there. So I don't believe fibromyalgia is an autoimmune disease. We don't know if chronic fatigue syndrome is. It probably could have an autoimmune component to it. We haven't found that yet
You
either.
see a lot of thyroid autoimmune people that have fibro though?
Yeah, now that I was going to say is see a ton of autoimmune Hashimoto's thyroiditis. So and the patients that I work with, I find about 70% of them have something wrong with their thyroid. Many of those have Hashimoto's. Many of those with Hashimoto's have never been properly diagnosed. So they have this festering symptoms they had for 5, 10 years, and no one's ever checked their antibodies, their thyroid antibodies, so they never knew they had it. But yeah, definitely that. But I don't see lupus. I don't see rheumatoid. I don't see Sjogren's. It's there. It can be, it could be a companion to the fibromyalgia, but it's not what's driving the fibromyalgia.
Yeah, because I do see patients though with a lot of the Hashimoto's and the fibro, and of course I do find that like cutting gluten out really helps a lot of the pain symptoms. And I know gluten plays a big role with gut permeability. So even though the research may not show that, I have a sneaking suspicion there has to be something underneath the hood, or we wouldn't see a lot of these connections when you address them. They improve a lot of those fibro symptoms.
Yeah, that's one of the big conundrums for fibromyalgia. I
Hmm.
think there's just so many things that are wrong.
Yes, that's the hard part.
Can right itself the way that you and I were trained in chiropractic school about innate intelligence. We're born with this incredibly inborn healing dynamo system that normally we don't have to think about taking 12 breaths per minute or pumping blood through 60 miles of arteries and veins. We just
Right.
these things. But with fibromyalgia, those systems get compromised. The hypothalamus, the pituitary, the adrenals, the HPA axis, when it gets under too much stress, it can't regulate these different systems. And now, because of that, you just see so many symptoms start to show up because so many systems are not working like they're supposed to. And that's incredibly challenging for the doctor that wants to try to treat fibromyalgia. Most won't because it's too complicated. And it's incredibly challenging for the patient because where do you start?
No, I totally agree. And you've done a great job during the podcast just to kind of outline a couple of the really good pillars. Obviously, we have the the Fibro Summit coming up in the next 2 weeks on the 28th. So really excited. We're going to put the links down below as well. I see a book on the shelf back there. Is that your book? Would you mind putting it on screen?
Yeah, so this is my treating and beating fibromyalgia and chronic fatigue syndrome book. It's in its fifth edition. The sixth edition
Wow.
out in November. So yeah, labor of love. For the last 20 years, it's been my mission to help those with fibromyalgia learn how to live healthier, happier, more productive lives because what they're being told right now, Justin, is just learn to live with it. But nobody
Totally.
wants to learn to live with chronic pain, no energy, brain fog, insomnia, restless leg syndrome, irritable bowel. I mean, that's not living, that's existing. So, the Fibro Summit is an opportunity for individuals with fibromyalgia to get a breath of fresh air instead of all the doom and gloom out there. They actually can learn from people like yourselves. You did a fantastic interview all about thyroid. We did a deep dive into that in
Yes.
the interview. So people like yourself are sharing incredible information that if you have fibro, or even if you just want to be healthier, there's so much we share in the summit about mold and parasites and adrenal fatigue and insomnia and leaky gut and gluten intolerance and food allergies.
Huge.
If you just can get a few little key things from these interviews, it may be the missing piece of the puzzle that you need to put it all together and get your life back.
I think that's awesome. Now, if patients want to get a hold of you, they're like, great, I'm going to get the book. I'm going to get the summit. I'm going to start applying some of this stuff, but I want to work with you. How do patients work with you?
Yeah, so appreciate that. They can go to yourfibrodoctor.com, yourfibrodoctor.com, and there's free videos on there. There's blogs. There's all kind of free protocols and tremendous amount of free information. So I encourage you to check it out, see if it resonates with you, and just if it does, then that you're on the right track.
That's great. We'll put the links below for the book, for the summit, for Dr. Rogers' website. Dr. Rogers, anything else you want to leave the listeners with? Do you have a YouTube channel or a podcast? Anything else people can get more info about you?
Yeah, so we do have a YouTube channel, and you'll see that on the website, a blog, both of those. Podcasts coming soon, and you're going to be one of my first guests, by the way.
Oh, great.
Will be coming soon. And I just want to say thank you. I want to thank you for everything that you do, because the information you're sharing is so needed. And without people like yourself taking the time, making the time, because I know you're busy just like I am, and you're dedicated to getting the message out there that you don't want to be just treating symptoms. You really want to be finding and fixing these underlying causes, whether you have fibromyalgia or you have migraine headaches or type 2 diabetes. And your podcast, which I've been checking out here recently, is just fantastic. So thanks for what you do.
Thank you so much, Dr. Roger. Really appreciate it. And people listening, it's so much information here, especially if you're coming at this with fibro or chronic fatigue. It's hard to grab a lot of these things. So just rewind it, listen to it again, try to grab one thing that Dr. Roger said, try to get the book, get access to the information, and make sure you get on that summit. Amazing, great speakers there. Dr. Roger, thank you so much for being a part of today's podcast.
Thank you, Justin. So appreciate it.
Thank you.